So, hello everyone. In this video, I am going to explain about a very important clinical sign that you have to elicit while doing examination of all systems in general medicine, that is clubbing. So what is clubbing? It is nothing else but the bulbous enlargement of the distal phalanx. A lot of theories has been proposed regarding the development of clubbing, out of which the well-accepted theory is the involvement of vascular endothelial growth factor and platelet-derived growth factors, which will stimulate the proliferation of vascular connective tissue, okay, and that is well manifested in our distal phalanx. So coming to how the clubbing will be presented, it will be either painful or painless. It will be either unilateral or bilateral clubbing, and the examiners will ask you what are the causes of unilateral clubbing. So remember, unilateral clubbing is associated with AV malformations, number one, and number two, it is seen in autoimmune hyperthyroidism, okay, and where this clubbing occurs unilaterally. And the rest of the cases of clubbing usually tends to be bilateral. And this clubbing can be either congenital or familial, which occurs in 5 to 10% of cases, and rest of the 70 to 80% of the cases will be acquired causes. So coming to what are the grades of clubbing, and then we will go for what are the causes of clubbing. So the grade 1 is something what we call it as the positive fluctuation test. Grade 2 is called as obliteration of the Lowy bond ankle. Grade 3 is the parrot beak or the drumstick appearance. And the grade 4 is the most severe form of clubbing. We call it as hypertrophic pulmonary osteoarthropathy. See, how will you test the fluctuation? See, using the middle finger, we will hold the proximal phalanx of the finger in which the clubbing is going to be examined. Using our index finger and the thumb, we are going to elicit the fluctuation. Okay, and this image shows the correct way of doing fluctuation, which is given in Macleod. So this is grade 1 clubbing. Normally, we have an ankle in the nail bed. Okay, when this oblate ankle, so called as a Lowy bone ankle, undergo obliteration, we call it as grade 2 clubbing. Whenever there is, parrot beak appearance, we call it as grade 3 clubbing. In severe form, because of excessive proliferation of the fibroblast, there will be periosteal deposition or periosteal reaction which happens in the subcutaneous layer, leading to some new bone formation. We call it as hypertrophic pulmonary osteoarthropathy, associated with worse prognosis, which is very commonly associated with underlying bronchogenic carcinoma. So these are the various grades of clubbing that you have to remember. Then coming to what are the causes of clubbing, remember around 70% of the clubbing is associated with respiratory illness, out of which most of this respiratory causes of clubbing results in painful clubbing. Example, empyema thoracis, bronchiectasis, lung abscess, bronchopleural fistula. All these collectively we call it as the suppurative lung disorders. As I have told, it is also associated with bronchogenic carcinoma, which is presented as the grade 4 clubbing, and mesothelioma, pulmonary fibrosis are also the various causes of respiratory causes of clubbing. Coming to the serious causes, I have already mentioned, one is AV malformation, next is cyanotic congenital heart disease like the tetralogy of Fallot, even infective endocarditis present with clubbing. And coming to gastrointestinal causes of clubbing, the most important is IBD, inflammatory bowel disease, which includes the Crohn's and ulcerative colitis. Along with that, we have something what we call it as a primary biliary cirrhosis and even celiac sprue present with clubbing. And the other causes which I have already mentioned, which is the unilateral clubbing cause, that is autoimmune hyperthyroidism. As a result of thyroid acropathy, what will happen? There will be unilateral clubbing. So in this video, I have mentioned what is clubbing, what are the causes of clubbing, what are the grades of clubbing, how will you elicit fluctuation, and last but not the least, just check yourself whether you are having clubbing or not. Just do this. Okay, just do this. You are able to see on diamond-shaped window here. This is called Shamroth sign. Normal patient, this diamond-shaped window is visible. In patients with clubbing, this Shamroth sign is negative. So normally Shamroth sign positive, Shamroth sign negative is clubbing. So hope this video is helpful for all of you. Save it. Thank you.